Hi everyone, my name is Matthew Bainbridge and my presentation is on stroke neuropathology. I'll be discussing what a stroke is, the different kinds of strokes, symptoms of strokes, as well as treatments used to help preserve brain cells that are at risk. I'm sure everyone has heard of the term stroke at some point in their life, but maybe you aren't aware of exactly what it means to have a stroke. A stroke is when the flow of blood to the brain is interrupted or reduced. This results in insufficient levels of oxygen and nutrients reaching the brain, which in turn can cause massive cell death if untreated. Generally, the reduced blood flow can be attributed to a blockage, which is a buildup of fatty deposits that form plaque, or it can be when a blood vessel within the brain ruptures, causing tissue to die. There are three main types of strokes: ischemic strokes, which are strokes that occur because of a blockage, or from the narrowing of arteries which provide blood to the brain. A severely reduced blood flow is known as ischemia, which is a term I'll be using frequently throughout the presentation. The blockages are caused by either blood clots, which can form directly in the arteries connecting to the brain, or in the blood vessels that get carried along the bloodstream into the narrower arteries within the brain. Hemorrhagic strokes are strokes that occur because of arteries leaking blood or from arteries completely bursting open. The leaked blood can put pressure on blood cells and cause them damage. This blood can spill into the space between the brain and the skull. Arteries can be weakened by several things. Hypertension, which is a big one. There's also trauma and aneurysms that can cause this deficiency in the arteries. The final type of stroke is known as transient ischemic strokes or mini strokes, which are strokes that mimic the properties of ischemic strokes. The difference is the blockage causing the mini strokes are only temporary, whereas the blockage of the ischemic strokes are there until methods are used to remove it. Mini strokes are used as indicators of future full-out strokes. There are several symptoms of interest when looking at strokes, and these symptoms are important in figuring out what's going on in a neural level. Symptoms appear suddenly and without warning, and these symptoms include confusion, trouble with speaking and understanding, headache, possibly with altered consciousness and vomiting, numbness of the arm, face, or leg, particularly on one side of the body, trouble seeing in one or both eyes, and trouble with walking, dizziness, and a lack of coordination. There are two main strategies in the treatments of strokes. The first one is insult limitation, which is restoring the blood flow before the infarction can occur. This method is used to save as many of the brain cells as possible and reduce the potential damage that occur in the brain. This method uses a drug called tissue plasminogen activator, or TPA, and it's used to dissolve the blockages. The sooner the drug is administered to the patient showing symptoms, the better the results will be, because the fewer brain cells will die due to the insufficient amount of oxygen and nutrients. The second strategy in treatment of strokes is called neuroprotection. And this method is used to find and block the mechanisms involved in cell death. Strokes cause cells to die in two different ways. The first is known as necrosis, which is cell swelling and the failure of the cell's outer membrane. And the second is known as apoptosis, which is when cells shrink. And this is what activates the key suicide genes in the cells. Having a good understanding of the treatments is useful for understanding what is happening during a stroke. However, we've only scratched the surface in terms of what is really going on. A more in-depth analysis of the body is needed to fully understand why a reduced blood flow to the brain is detrimental to an individual's health. Understanding a stroke at the level of neurons. We know that ischemia decreases the amount of oxygen as well as the amount of important nutrients like glucose that reach the brain. When the brain stops receiving adequate amounts of oxygen and essential nutrients, it triggers a series of negative events. Brain cells are not able to work as efficiently and effectively as they can, which causes the brain nerve cells to lose their energy stores and consequently their membrane charge. This causes a never-ending depolarization in the nerve endings, which in turn cause them to release all of its excitatory neurotransmitters, or glutamate. This excessive release of glutamate causes a buildup outside of the cells and overstimulates the glutamate receptors of surrounding cells. Because of these glutamate receptors being overstimulated, they allow the free flow of calcium and sodium ions into the nerve cells. The flow of calcium into the cell causes a lethal biochemical consequence, which equals cell death. There are two different types of treatments that focus on necrosis and others that focus on apoptosis. Necrosis treatments focus on stopping the free flow of calcium ions into the nerve cell by introducing glutamate antagonist drugs, which in turn block the receptors from allowing calcium and sodium into the cell, which would ultimately stop cell death. These treatments also look at the downstream effects due to calcium overload, which are disturbances in the behavior of internal energy factories, or the mitochondria, productions of toxic molecules, and the activation of destructive enzymes. This shows that the signaling in the glutamate pathway isn't the only factor involved with cell death. The other factor involved with cell death is that of zinc. Many nerve terminals that release glutamate also release zinc for reasons of neural signaling. When there's an excess release of glutamate, there's also an excess release of zinc. However, zinc doesn't cause cell death because it allows calcium and sodium ions into the cell. It's dangerous because zinc itself enters the nerve cells in excessive quantities. To prevent zinc from entering nerve cells, an experimental drug called EDTA is administered, which binds to zinc and which enables it from entering the nerve cell. The apoptosis treatments are treatments where researchers won't only focus on nerve cell swellings, they are also concerned with nerve cell shrinkage. This occurs when the flow of calcium and sodium ions into the nerve cell is reduced. However, large amounts of potassium ions flow out of the cell, which causes the cell to shrink and triggers cell suicide. Approaches that incorporate both necrosis and apoptosis treatments are most beneficial to stroke patients in saving majority of their nerve cells. Symptoms and cell problems. We are aware of the fact that different brain areas control different functions within our bodies. For example, we know that the primary motor cortex in the brain is responsible for the movement of our body and its parts. Therefore, when a stroke occurs and brain cells die in that region of the brain, it would cause the problems in walking and the troubles with coordination. We can also see this when nerve cells die in the left hemisphere of the brain, causing numbness on the right side of the body and vice versa. Sorry. And this is true for other regions of the brain. The more brain cells that die in certain regions, the more damage will be caused. The more damage will be caused to the brain, which in turn will permanently damage the respective areas that the brain controls. There is a strong correlation between the symptoms that are present during a stroke and the brain area that is being affected. I hope that my presentation was insightful and helped you learn a thing or two about what happens in our bodies during a stroke.